So good day, ma'am. I'm Jhazle Jade Piedad, BSN2F, Cluster A, Group 22. So Partograph is to monitor the progress of labor and identify and intervene in case of abnormal labor. So I will present the Partograph of Miss Laila Ahmed with Gravida 2 and Parity 1. So she is admitted on October 1, 10 a.m. So first, I'll explain the fetal heart rate. As you can see upon admission, the fetal heart rate is 140 and has intact membrane here. Then after 4 hours, the fetal heart rate lowers from 140 to 130 and the membrane have been ruptured and the amniotic fluid is clear here. Then after 4 hours, we can see the drop of fetal heart rate to 100 with the sign of meconium staining and molding also, because there is a overlapping of a bone, but it is reducible, which is marked with plus plus. So here, upon admission, the dilatation is at 5 cm, and after 4 hours, it became 7 cm. Then after 4 hours, it's still at 7 cm. So this line, it is a sign of arrested dilatation. This is when there is no progress of cervical dilatation for 1 hour in multigravida. Where here we should assess the pelvic size, presentation, and position to rule out feto-pelvic disproportion. And after that, decision should be made if cesarean delivery is to be done. And then the descent, there is also a problem in descent because the client is multigravida. The descent should be greater than 2 cm per hour. But as you can see here, it is only descended for 2 cm in 4 hours, which is protracted descent. Then, so this is the reason why there is a drop of fetal heart rate. It is because the arrested dilatation here, the straight line here, and the protracted descent. Then now let's proceed with the contraction. So here, so there is 3 per 10 minutes of contraction with duration of 35 seconds. And after 4 hours, there is 4 to 10 minutes of contraction with duration of 45 seconds. And after another 4 hours, there is 5 per 10 minutes of contraction with duration of 55 seconds, which is in normal range. Then the next is the pulse rate. As you can see here, the first is 90, which is normal. Then after 4 hours, it became 88 here at first. Yeah, 88. Then it became 90. Then it became 100, which is normal pulse rate. Then the blood pressure of the patient. At the admission, prior to admission, the BP is 120/70. Then after 4 hours, it became 130/70. Then after 4 hours again, it became 140/80, which is a signs of pregnancy-induced hypertension, and it became the then as you can see here, there's a presence of protein in the urine of the patient, which is an indicator of PIH. Then next is the temperature. So as you can see, 37.5, which is in the normal range. So that's it for my presentation of the Partograph of Miss Laila Ahmed.